Hey everybody, Dr. Mueller here, and in this video we're going to talk about Lyme disease rash and the rashes that we see with this particular type of infection. Now, it's important to realize that it's estimated that actually only about 25% of people that get infected with Lyme disease, which is a bacterial infection that comes from insects. It comes from many different insects, most commonly ticks. And this bacterial infection for some people in the acute phase, when they contract this bacteria from a insect bite, they get a rash. The problem is that we used to think that the rash was highly common, and some of the most updated research is really telling us that this rash may only be occurring in about 25% of people. Therefore, if you do wind up getting this rash, it typically looks like a bullseye, kind of like a target. If you do get this rash, you definitely want to get proper Lyme disease testing done. You'll see more information on our YouTube channel, on our blog. You'll see more information about proper Lyme disease testing and some of our resources. And you also want to make sure that you are working and you realize that if you do not have this rash and you were bitten by a tick, for example, this does not mean that you are free from the disease. Many people do not get the rash. And oftentimes early signs of this bacteria infection from Lyme disease, or that causes Lyme disease, the bacteria is called Borrelia. And oftentimes what we see is that early symptoms can oftentimes look like a flu. And what can happen is people can think they just have a flu, they get sick, it goes away, and then years later, they have symptoms that are much more severe. It's sometimes thought, because the rash typically is this target lesion, it's sometimes thought that what's happening is what you're seeing with the rash is almost like the Lyme, the bacteria disseminating, spreading, moving throughout your body. The bacteria Borrelia does have a flagella. It has a tail on it, and that tail, it does allow it to move pretty quickly and hide in your body's cavities, joint spaces, these sorts of things. So the rash, when you're looking for the rash, if you're looking for the rash, the other thing to consider is the rash can hide in places like in our hairline. So sometimes if people were bitten by a tick and it happens to be on their head, that rash, they might even be present and they might not even see it because it's in the middle of their scalp, underneath the hair, where it's not apparent. So make sure you really don't think about the rash as being present or not present as a way of diagnosing Lyme disease. And if you're worried about having Lyme disease, you get proper testing and treatment. If you want any support and if you want to learn more about Lyme disease, please do check out my Lyme Doc clinic, where we have people on our team that are available to help with recommendations for you. You can find more information about us in the captions below. And if you like this information, please do subscribe to my channel. Thanks so much. See you next time.